this is an iHeart podcast. Guaranteed human.
It's an Olympics you'll never forget. Prime time in Milan. The moments.
Chloe Kim with the gold medal flex.
The stars.
Ilya Malinin.
Out of this world.
The spectacle from beautiful northern Italy with very special guests every night of the Olympics. Experience the world's biggest show. Prime time in Milan. Tonight, 8/7 Central on NBC and Peacock.
The big game commercials are basically must-see TV. This year, Elf Cosmetics went all out with an absurdly funny telenovela called Melissa. It stars Melissa McCarthy, Nicholas Gonzalez, Itati Cantoral, and Elf Glow Reviver Lip Oil. The Elf Glow Reviver Lip Oil is an ultra-glossy tinted lip oil that nourishes, hydrates, and enhances your lips' natural color.
Watch the full episode of their new Elf novela on soyunbaño.com.
Ever wonder why so many people regain weight after stopping a GLP-1? Up to 40% of the weight lost can come from lean muscle. This weakens the body, slows metabolism, and makes it easier to put the pounds back on, creating a cycle of dependency. Prolon's 5-day fasting-mimicking diet offers a drug-free way to maintain results and support long-term metabolic health. In just 5 days, it activates fasting pathways to burn fat, protect muscle, and rejuvenate cells, all while letting you enjoy real food. Get 15% off plus a $40 bonus gift when you subscribe at prolonlife.com/iHeart. That's prolonlife.com/iHeart.
Over the last couple years, didn't we learn that the folding chair was invented by Black people because of what happened in Alabama?
The Montgomery Brawl.
This Black History Month, the podcast Selective Ignorance with Mandy B unpacks Black history and culture with comedy, clarity, and conversations that shake the status quo. The Crown Act in New York was signed in July of 2019, and that is a bill that was passed to prohibit discrimination based on hairstyles associated with race. To hear this and more, listen to Selective Ignorance with Mandy B from the Black Effect Podcast Network on the iHeartRadio app, Apple Podcasts, or wherever you get your podcasts.
Welcome to The Middle. I'm Jeremy Hobson, along with Tolliver. Hi, Tolliver.
Hey, how's it going, Jeremy? Hey, I just want to let our listeners know I had a show last night and a recording session. So if I hit puberty during the show, that's what that is, okay?
Right. Well, it's good to have you here tonight. And we also welcome the listeners across the state of Wyoming on Wyoming Public Media to the show. And what a week of news it has been. President Biden was in Israel. The war there continues. Huge protests around the Middle East. Concern about a worsening humanitarian situation in Gaza, and just heartbreaking interviews with family members of the Israeli hostages. Now, last week on the show, the war was our topic, and we got many more calls than we could get on the air. Here are just a few of them.
Hi, my name is Sam. I'm calling from Clearwater, Florida.
Hi, my name is Justin Stewart. I'm calling from Houston, Texas.
Hi, my name is Ali. I'm in Chicago.
Hi, Jeremy. This is Beth from Pittsburgh. How the hell is Israel supposed to try to make peace with neighbors who want Israel to not exist?
Why it's okay to call Hamas terrorists when they kill children and civilians, and it's not okay to call Israel the same?
I am a staunch conservative. I am not pro-Israel. I am not pro-Palestine. But I want to know, why is this happening? What is the root? Why is this even a thing?
We hear one Israel has passed away, was killed. But if 20 people of Palestinians have been killed, nobody cares about that. This is a double standard to the world. Palestinians live in the biggest world of a prison. Why can't we solve the issue where the problem is coming from?
Well, we could have easily done another show about what's going on in the Middle East, and maybe we will need to do that next week. But there is a topic that often gets pushed aside by other news, even though it is killing hundreds of Americans every day and will likely kill a record number of Americans this year. That would be the opioid crisis. And what we want to know from you this hour is what solutions are working in your community when it comes to dealing with the opioid crisis, which has been going on for many years. Tolliver, can you give them our phone number, please?
Yes, it's 8444-MIDDLE. That's 844-464-3353. You can also write to us at listentothemiddle.com, and you can find our social media handles there as well.
And before we take calls, let's meet our panel. Joining us from Roanoke, Virginia, Beth Macy, author of the book Dopesick, which has been adapted into a Hulu series. She has a new book out called Raising Lazarus, Hope, Justice, and the Future of America's Overdose Crisis. Beth Macy, welcome.
Thanks for having me. Appreciate it.
It's great to have you. And we're also joined from Phoenix by Dr. Nora Volkow, director of the National Institute on Drug Abuse. That's a federal agency that funds scientific research on the health aspects of drug use and addiction. Dr. Volkow, welcome to you.
Thanks very much, Jeremy, and thanks for having me.
Well, and I want to, before we get to our callers, ask each of you a question. And Dr. Volkow, let me just ask you, if you could, define the opioid crisis right now. It's been going on for many years, but what is it in the United States in 2023?
Well, we see it as a crisis that actually has reached the highest levels in terms of mortality that we have ever seen. It's also a much more complex crisis than it was 2 decades ago, because though we now see that the main cause of driving the mortality is fentanyl, which is a synthetic opioid, we are more frequently seeing it combined with other drugs like cocaine or methamphetamine or xylazine. So this has made the control of the crisis so much more harder, because people that want to take cocaine or may not be seeking fentanyl may end up with a drug that contains a mixture. So we have seen that diversification of the people that actually across all demographics that actually where we're seeing overdoses from fentanyl or drug combinations.
And when you talk about people who they want to do cocaine or methamphetamine and then there's fentanyl mixed in, does that then lead to an accidental overdose, or does that get them addicted to fentanyl?
Well, it can happen both ways. It can lead to someone without knowing that they become physically dependent to the opioid, and they don't realize why they feel so uncomfortable when they are not taking their cocaine. And then that may lead them to just look at products that have fentanyl eventually that could result in an overdose or death. When someone is not seeking fentanyl, doesn't know that they're taking it, they don't have the tolerance that usually someone that's taking opioids, whether it's heroin or prescription or opioid medications, have. So they have higher risk of dying from it. So in this respect, some use the term that people are dying because they are being poisoned by consuming a substance that they didn't know they had. Mm-hmm. But the reality is it's an overdose driven in many instances by fentanyl and by the exacerbated lethality when these drugs are combined. So you have higher risk when you have stimulants with fentanyl or alcohol with fentanyl or benzodiazepines with fentanyl.
Beth Macy, you've been covering the opioid crisis for years. How would you define it right now?
I would say Dr. Volkow nailed it. I would also point out the fact that, I think for the first time, we lost over 1,000 teenagers, and these weren't people who were addicted per se. They were experimenting like many teenagers do, and instead of taking a Xanax they bought off the street, it was actually a fentanyl. So the drugs are just getting more dangerous. And until we start to make the treatments easier to access than the dope, we're going to continue to see an increase in overdose deaths.
Let's get to a call. We're getting a few that are coming in right now. I'm going to go to John, who's on the line from Boulder, Colorado. John, go ahead. Welcome to The Middle.
Hey, thank you very much for having me on The Middle. Much appreciated. Yep, I actually agree with a lot of what she said. At the same time, I would feel like our schools are not doing enough. I think our parents are more scared about this and not talking to their kids about it enough. I have 2 teenage daughters, and I obviously have a very open-door policy with them, being a former addict and alcoholic myself, going through it, 10 years sober. But the one thing that really kind of scares me is I still see a doctor about this, and he runs a clinic where he's giving out maybe 200 urines to check for the drugs that they're on, and he hasn't seen heroin in over 2 years. All his urines are all fentanyl. That just shows you how bad it is in Denver. So I don't think we're doing enough. Obviously, naloxone is a very big step, but I think people really have to understand the consequences of what withdrawal does, how much you screw up your life, the shame. It's not enough that's being brought out, that an addict has to kind of go through it to understand it. And I think overall there needs to be more that has to happen on the school level, but also on the home level as well, too.
Well, and actually, I read that it takes the average opioid addicted person 8 years and 5 to 6 treatment attempts to achieve 1 year of sobriety. John, since you say you're a former addict yourself, and congratulations on being sober for 10 years, what was there something that you would counsel other people on how to do that, how to do what you did?
Yeah, people have to do it their way, you know. I mean, being in the rooms really kind of brought up a lot of like war stories that really kind of hurt me. It made me feel more shame. So I kind of did it myself, and I tapered off the Suboxone, which was worse than getting off heroin, and then I Sublocade a couple of times, and I finally forgot about it, and it finally went away. But overall, you know, switching one drug to another doesn't work really well. You need to switch your lifestyle around, and that's something I've done. I've lost 100 pounds since I quit using drugs, and swim every single day. And overall, I got to tell you what, I've never had a better relationship with my kids after beating heroin. And overall, that's what to live for. And I missed out on a lot, and there's a lot of shame there too. So I'm still getting over that part. It doesn't go away very easily. So there's a lot.
Well, John, thank you so much for your call. Really appreciate it. Dr. Volkow, as you listen there to John, your thoughts?
Yeah, I first of all, I think I want to thank John for sharing with us his experience, because we don't hear enough of success stories of people that have been able to overcome their addiction and completely go back to having a very fulfilling life, which is what I basically heard expressing, certainly one that he feels proud about, and speaking about his own family. I think that the message that we need to understand is that addiction is a disease, an opioid addiction that can be treated, and that people recover and can lead normal lives. The aspect about it right now that we also need to emphasize is that the illicit drug supplies is extremely dangerous because of the.
Hey, I like your new RAV4.
Thanks, yours too.
What does RAV stand for anyway?
To me, it's the Remarkably Advanced Vehicle.
Really? To me, it's the Runway Approved Vehicle for its amazing style.
What about Remarkably Adaptable Vehicle because of its versatile cargo space?
Or Really Admired Vehicle?
Oh, or Really Awesome Vehicle.
It really is the recreational activity vehicle. The stylish 2026 Toyota RAV4 Limited. What's your RAV4?
Contamination of fentanyl. So as a result of that, your likelihood of dying if you take these drugs is much higher than what it was 1 decade ago. Mm-hmm. And in this respect, for example, medications that we use for treating people with opioid use disorder actually not just allow to decrease the craving and desire for the drug and to control the withdrawal, but they protect you from dying from an overdose. So they are very, very useful medications, and we should make them available. And so the extent to which then that we build will help that person rebuild their life. And at one point, and we're studying this, is to help us understand when the person can be tapered from those medications. Currently, we recommend long-term treatment with the use of buprenorphine, methadone, or Vivitrol as basically the most effective way to address the craving, the withdrawal, and to prevent from overdoses.
And I want to get more into some of the things you just spoke about, including naloxone and other ways that we can deal with situations where people are dealing with overdoses in a few moments. And we've got many more calls coming in. But I want to bring another thing up. Tolliver, when you look at polling on this issue, there is a Morning Consult poll that finds Americans most often blame Mexican drug cartels for this crisis, followed by the users themselves.
Yeah, and Jeremy, there have also been so many lawsuits against the drug companies, including Purdue Pharma, maker of OxyContin. And you can probably see why when you hear this clip from an internal Purdue marketing video from the 1990s.
Once you've found the right doctor and have told him or her about your pain, don't be afraid to take what they give you. Often, it will be an opioid medication. Some patients may be afraid of taking opioids because they're perceived as too strong or addictive. But that is far from actual fact. Less than 1% of patients taking opioids actually become addicted.
Wow. It sounds like the tobacco executives on Capitol Hill those many years ago saying that nicotine was not addictive. Stay with us. More of The Middle coming right up.
It's an Olympics. you'll never forget. Prime time in Milan. The moments.
Chloe Kim with the gold medal flex.
The stars.
Ilya Malinin.
Out of this world.
The spectacle from beautiful northern Italy with very special guests every night of the Olympics. Experience the world's biggest show. Prime time in Milan, tonight 8/7 Central on NBC and Peacock.
Welcome to the A Building. I'm Hans Charles.
I'm Menelik Lumumba. It's 1969. Malcolm X and Martin Luther King Jr. had both been assassinated, and Black America was at a breaking point. Rioting and protests broke out on an unprecedented scale.
In Atlanta, Georgia, at Martin's alma mater, Morehouse College, the students had their own protest. It featured two prominent figures in Black history, Martin Luther King Sr. and a young student, Samuel L. Jackson.
To be in what we really thought was a revolution. I mean, people were dying.
1968, the murder of Dr. King, which traumatized everyone.
The FBI had a role in the murder of a Black Panther leader in Chicago.
This story is about protest. It echoes in today's world far more than it should, and it will blow your mind.
Listen to the A Building on the iHeartRadio app, Apple Podcasts, or wherever you get your podcasts.
This is Ryder Strong, and I have a new podcast called The Red Weather.
It was many and many a year ago in a kingdom by the sea.
In 1995, my neighbor, Anna Trainer, disappeared from a commune.
It was hard to wrap your head around. It was nature and trees and praying and drugs.
So no, I am not your guru.
And back then, I lied to my parents, I lied to police, I lied to everybody.
There were years, Ryder, where I could not say your name.
I've decided to go back to my hometown in Northern California, interview my friends, family, talk to police, journalists, whomever I can, to try to find out what actually happened.
Isn't it a little bit weird that they obsess over hippies in the woods and not the obvious boyfriend?
They have had this case for 30 years.
I'll teach you sons of to come around here and my wife. Boom, boom.
This is The Red Weather. Listen to The Red Weather on the iHeartRadio app, Apple Podcasts, or wherever you get your podcasts.
Segregation in the day, integration at night.
When segregation was the law, one mysterious Black club owner had his own rules.
We didn't worry about what went on outside. It was like stepping in another world.
Inside Charlie's Place, Black and white people danced together. But not everyone was happy about it.
You saw the KKK?
Yeah, they was dressed up in their uniform.
The KKK set out to raid Charlie, take him away from here.
Charlie was an example of power. They had to crush him.
From Atlas Obscura, Rococo Punch, and Visit Myrtle Beach comes Charlie's Place, a story that was nearly lost to time. Until now. Listen to Charlie's Place on the iHeartRadio app, Apple Podcasts, or wherever you get your podcasts.
This is The Middle. I'm Jeremy Hobson. If you're just tuning in, The Middle is a national call-in show. We're focused on elevating voices from the middle, geographically, politically, and philosophically, or maybe you just want to meet in the middle. My guest this hour, Dr. Nora Volkow, director of the National Institute on Drug Abuse, and Beth Macy, author and executive producer of Dopesick, a book and now TV series on Hulu. Her latest book is Raising Lazarus, and we are talking about America's opioid crisis. We want to hear from you. Have you been affected? What solutions are working in your community? Tolliver, what's that number again?
It's 8444-MIDDLE. That is 844-464-3353. Give us a call.
And let's get back to the phones. Cody is joining us from Las Vegas. Cody, go ahead. Welcome to The Middle.
Hi, thank you. I'm listening to you on KNPR, our local station. I'm a nurse and a paramedic. When we have big festivals like we do here in Las Vegas and Nevada in general, the state and the public health agencies provide naloxone overdose kits on a no prescription, just here, take it, here's how to use it. And they provide free, no questions asked drug testing at major festivals through the health department just to get the fentanyl out of there. What are the barriers to this being a more universal action on the part of public health and or communities in general? And thank you for your time.
Thank you, Cody. Great question. Beth Macy, what about that? What are the barriers to getting fentanyl test strips and naloxone more widely available? And is that, do you think, a solution that could really make a difference?
I think it could make a huge difference. And naloxone is free in many states, over the counter anyway. The fentanyl test strips are largely distributed by health departments in a more on-the-ground method by harm reduction groups. And I love harm reduction because not only are they handing out fentanyl test strips, clean use supplies, clean needles, but they're also people who go to harm reduction groups are 5 times more likely to eventually enter treatment because people who are using drugs need to build back those little threads of trust. And when you see that start to happen, you start to bring in this 40% of American drug users who say they don't want to stop using, who don't think they can get better. And as a caller earlier mentioned, people can get better. Dr. Volkow mentioned that. We still are treating this as not the disease that it is. And folks in active use don't think they can get better. And Americans they also have a lot of skepticism about that. And so first we've got to build up some hope with this, right? We've got to start to work on that 87% treatment gap.
Well, what do you mean we are not treating this as the disease that it is?
Well, I would say largely, systematically, looking at everything, courts, cops, healthcare, harm reduction, we're still treating it as a criminal action. We're not treating it like a disease. The number one a tool that the government uses is still incarceration, and that's from a historic war on drugs that was racist by design, that goes right back to Nixon, trying to shore up Southern votes and disproportionately incarcerate Black and brown people. We have all grown up thinking that people who use drugs are moral failures and criminals. And most jails don't offer treatment. They certainly, many don't offer evidence-based treatment or medication-assisted treatment. And that's a real problem because when you get out of jail, you're 40 times more likely to, if you use again, to overdose and die because you've been opioid naive.
Let's go to another call. Joyce is with us from Nashville, Tennessee. Hi, Joyce. Welcome.
Hi there, and thank you for taking my call, and thank you for doing this program.
Go ahead. What's your experience with opioids, or is there a solution that you've found that could work in helping deal with the crisis nationwide?
Okay, I just want to say up front, I am not a recovered person, and I have other addictions, but not drugs, and I don't want gold points for that. I've just done it my way. I'm straight out of New York, and I've been in Nashville since 1979. So I say all of that. I started the first needle exchange program with a minister and another, Ron Crowder, who is a superstar. So I'm not foreign to the work that what we're talking about tonight. But quickly, though, everything that's been said is absolutely correct in terms of Black and brown people are infected and affected by this disease right now, and I call it people are being poisoned because of the fentanyl. We talked about the teenagers. What's not being done, the health department is really doing an outstanding job. I work for Meharry. I am 81 years old. They hired me because I know the streets of Nashville, and it's not politically correct, but here I am doing this. But the issue of not in my backyard, the pieces that are missing is things like what's going on in New York with One Point. They have a site, which I understand, and I may be incorrect on this one. It's not funded by the city or the state. They write grants like everything else that's being done, even here in Nashville. Everything is grant. There's no budget for anything. There is, again, the health department does the testing of the drugs. They have Narcan that's being given out. You cannot get it over the counter because, well, you can, but Walgreens, CVS, it's $50. It's not free. You can't go in and say I need, and I want that to be heard, or at least that's what it is here. But
and Joyce, let me just stand by, because let me ask about that Narcan, Dr. Volkow. She said it's about $50. I think it's $50 for two, actually. But is that really? How much of a solution is that? Because don't you have to be in the right place at the right time with Narcan in order for it to work? What if somebody has an overdose and they're nowhere near somebody with Narcan?
Then you cannot give them. You won't be able to revive them. I mean, the challenge with Narcan is that it is a very effective medication, but you need to administer rapidly and at adequate doses. And so the issue, that's why what was commented by the prior person that called was that making it widely accessible for people at no cost is the ideal solution, because otherwise, while many people may be able to pay $50 for 2 doses of Narcan, those that need it the most, those that are in the highest vulnerable populations, $50 may make the difference or not of having it available or not. So the notion of over-the-counter Narcan or naloxone approved by the FDA was important because it gets more access. And it also sends the message that this is such a safe medications that the FDA approved it to be sold over the counter alongside your dental supplies or your soap. So it's felt as safe as that. But there have been concerns that the price may be a deterrent that may limit its access for those that need it the most. And we also have to ask ourselves the question, when we're distributing Narcan and naloxone, are we distributing at sufficiently high doses such that the people that need it will be able to use it? You don't want to be in a situation that there's not enough sufficient Narcan to properly revert someone who has overdosed. And this is particularly urgent with fentanyl, because what we're hearing and what researchers are documenting, that when people overdose with fentanyl, they may need more than 1 dose of naloxone, they may need 2 or 3. So if you don't have sufficient doses, you may not be able to properly recover that person and save them from dying. So yes, we want to make it widely available, but also accessible. That is to say that people can afford it.
We brought up fentanyl so much in this program. I think we should say that a lot of it is coming across the border. Fentanyl seizures at the Mexico-U.S. border increased 164% from 2020 to 2022. In this year, 21,846 pounds have already surpassed what came in last year. Beth Macy, there are many people that, as we said earlier, a lot of people blame Mexican drug cartels for this problem. How much of the fentanyl problem is because it's coming in from other countries?
Well, the supply is obviously a huge part of the problem, but if we simply cut it off, which is impossible without shutting down the border and messing up the economy, we still have this huge demand for drug use. We have 7 million people with opioid use disorder, according to the latest numbers I read out of a study in Science last year. It was 4 times more than what was previously known. And until we begin offering treatments at the scale to match the crisis, we're going to still have that demand. And you have folks going for xylazine, which is a veterinarian tranquilizer now. People are going to figure out other ways to not be dope sick. And so we've really got to work on making the treatments easier to get than the dope.
Let's go to another call. Joshua is joining us from Chicago. Joshua, welcome to The Middle. Go ahead.
Hi, guys. Thank you, and thanks for taking my call. So my name is Joshua. I'm from Chicago, and I'm gonna come at this at a little bit different angle. And on the other side of the fence, I'm a disabled veteran. I've been disabled for 23 years. I had 3 tours to Iraq pre 9/11. I was shot 3 times, and my left leg from the knee down, it was blown off. I suffer pain, and I'm going to tell you the biggest culprit in the beginning of this was our government, was the VA themselves. They sent me to a pain management doctor, and the doctor wanted to give me 12 Norco a day, 8 ibuprofen, and a fentanyl patch. And I looked at him and I said, "Are you out of your mind? You're going to kill me." And I've seen too many of my friends in the same situation that sat in the corner for 30 days, drooling from their mouth because they were so loaded up with the opioids. And I'm going to tell you that, so there's a difference between want and need. I think in addiction, you want, but then on the other side of the fence, people like me who rely on the medication and need it to have a better quality of life, we're affected because of the big opioid crisis, and everybody points the finger at it. And doctors are so scared to treat patients in that, that what's happening is patients that have been on a program and everything are cut off, and they go to the streets. In my area in Chicago, it's not the opioids. It's people who get cut off of the medications, and they go to the streets, and the next thing you know, they need something, so they're getting it's fentanyl or something synthetic. And folks, don't get me wrong here, and I'm not going to say this. So education, nobody really talks about education. I have a great doctor now. I have a pain management contract with her. I am urine tested every month. And, where I'm at in Illinois, they can track you through a system. So they know if I'm doctor hopping.
Yeah,
so,
Joshua, let me take your call to our guests. And first of all, thank you for your service as well, and thank you for calling in. Dr. Volkow, we actually got a couple of voicemails on this issue of people who say, look, I actually do need the pain medication, and the fact that doctors are afraid to prescribe it now because of the opioid crisis is making it more difficult for me to get it.
Yeah, and it could endanger it, just like your caller said, because if they have very severe pain and very intense, pain is a very aversive state, and your brain wants to get out of it. So people then may choose to go and buy illicit substances as a means to control their pain, and that may put them at much higher risk of dying from overdoses. So we need to realize that pain initiated this overdose crisis, and the way that it initiated in many ways reflected how neglected it has been as a field in medicine. We haven't invested sufficient resources to understand actually the different types of pain that exist. We do not know how to properly treat it. We don't get educated properly on management of pain. And we don't have many alternative medicines. We do have some analgesics, but some of these analgesics don't work for chronic severe conditions of pain. And there hasn't been sufficient investment by industry on the medications that can actually be safe for managing pain. And when there are alternative treatments for pain, they are more costly, so insurances don't pay them. So there are many structural issues that exist that have perpetuated, at first originated this overdose crisis, as was pointed earlier in the program, but also that continue to make pain a major challenge and cornering people that have no alternatives when their opioid medications, in cases where it was offering some relief, they cannot get access to them because physicians don't want to prescribe them anymore. So we are a country that is so very polarized. It's either we become over complacent and give opioid medications to anyone, or we don't. We basically say no, we're not going to give them. When in reality, we need to understand how to properly utilize them and how to help patients that are suffering from pain lead productive lives, even if it means, and this is something that we're changing, that they may have to learn to live with some level of pain, but they can achieve things that in their life, they can live their life, so that we minimize negative effects. And as an area of research, we see the responsibility that we have, certainly at the NIH, of advancing the science so that we can provide better treatments for people that need them. Because pain is not a rare condition. I mean, it's a very, very common, frequent presentation, and if not treated properly, can lead to actually very devastating outcomes such as suicide or overdoses.
We are also hearing from people who have written in via email. You can go to our website, listentothemiddle.com. To do that, we're also on social media, on most places, at Listen to the Middle. Buffy in New Orleans asks, we know people are going to use drugs, so why help them not die, get hurt, or get sick? Again, you can reach out at listentothemiddle.com. You know, Tolliver, and we're waiting for more calls. We've got some more calls on the line. We're going to get to them in a few moments. But this opioid crisis, as we've said, has been going on for many years. It is not a Republican crisis, and it is not a Democratic crisis.
Yeah, absolutely. And in fact, both Republican and Democratic presidents have, promised to solve the crisis over the last couple of decades. Check this out.
It's important to recognize that today we are seeing more people killed because of opioid overdose than traffic accidents.
In the last Congress, both parties came together to pass unprecedented legislation to confront the opioid crisis.
Addiction touches families in every community, in red states and blue states, across all races and creeds. The crisis is national, but the struggle is personal, deeply personal.
And given the current trajectory, President Biden is probably not going to be the last president to talk about the opioid crisis. Stay with us. More of The Middle coming right up.
It's an Olympics you'll never forget. Prime time in Milan. The moments.
Chloe Kim with the gold medal flex.
The stars.
Ilya Malinin.
Out of this world. The spectacle from beautiful northern Italy. With very special guests every night of the Olympics. Experience the world's biggest show. Prime time in Milan, tonight 8/7 Central on NBC and Peacock.
Welcome to the A Building. I'm Hans Charles.
I'm Menelik Lumumba. It's 1969. Malcolm X and Martin Luther King Jr. had both been assassinated, and Black America was at a breaking point. Rioting and protests broke out on an unprecedented scale.
In Atlanta, Georgia, at Martin's alma mater, Morehouse College, the students had their own protest. It featured two prominent figures in Black history, Martin Luther King Sr. and a young student, Samuel L. Jackson.
To be in what we really thought was a revolution. I mean, people were dying.
1968, the murder of Dr. King, which traumatized everyone.
The FBI had a role in the murder of a Black Panther leader in Chicago.
This story is about protest. It echoes in today's world far more than it should, and it will blow your mind.
Listen to The A Building on the iHeartRadio app, Apple Podcasts, or wherever you get your podcasts.
This is Ryder Strong, and I have a new podcast called The Red Weather.
It was many and many a year ago in a kingdom by the sea.
In 1995, my neighbor, Anna Trainer, disappeared from a commune.
It was hard to wrap your head around. It was nature and trees and praying and drugs.
So no, I am not your guru.
And back then, I lied to my parents, I lied to police, I lied to everybody.
There were years, Ryder, where I could not say your name.
I've decided to go back to my hometown in Northern California, interview my friends, family, talk to police, journalists, whomever I can, to try to find out what actually happened.
Isn't it a little bit weird that they obsess over hippies in the woods and not the obvious boyfriend?
They have had this case for 30 years.
I'll teach you sons of to come around here and my wife. Boom, boom.
This is The Red Weather. Listen to The Red Weather on the iHeartRadio app, Apple Podcasts, or wherever you get your podcasts.
Segregation in the day, integration at night.
When segregation was the law, one mysterious Black club owner had his own rules.
We didn't worry about what went on outside. It was like stepping in another world.
Inside Charlie's Place, Black and white people danced together. But not everyone was happy about it.
You saw the KKK?
Yeah, they was dressed up in their uniform.
The KKK set out to raid Charlie, take him away from here.
Charlie was an example of power. They had to crush him.
From Atlas Obscura, Rococo Punch, and Visit Myrtle Beach comes Charlie's Place, a story that was nearly lost to time. Until now. Listen to Charlie's Place on the iHeartRadio app, Apple Podcasts, or wherever you get your podcasts.
This is The Middle. I'm Jeremy Hobson. We're talking about finding solutions to America's opioid crisis. My guests are Dr. Nora Volkow, who is director of the National Institute on Drug Abuse, and Beth Macy, author of Dopesick and the new book Raising Lazarus, Hope, Justice, and the Future of America's Opioid Crisis. Our number is 844-4MIDDLE. That's 844-464-3353, or you can reach out at listentothemiddle.com. Let's go to another call. Jennifer is joining us from Minneapolis. Jennifer, welcome to The Middle.
Thank you very much.
Well, go ahead. Just go for it.
I'm waiting to actually make a plane reservation to go back to Philadelphia. On June 24th, my son was shot in the head buying fentanyl on the street in Philadelphia. He's been in and out of treatment. I've been waiting for a shoe to drop, and for some odd reason, like him getting shot in the shoulder was like the biggest blessing, because he's tried to break this addiction. He's been through treatment 3 times, and he just goes back. He's lived on the streets. He's homeless. He's been various things. He went to a very prestigious prep school on the East Coast, and 6 of his classmates are gone out of a very small number of people from a very privileged class. And that alone says that this thing is not, it's everywhere. It's not somebody else's problem. And
do you see anything that may be a light at the end of the tunnel for him, for you, as you navigate this?
I think that, like I said, this odd thing that, I mean, he gets shot, right? He didn't get shot directly in the head. It went through his shoulder, grazed his head, caused a brain bleed. So he's been without a cranium for 6 months. So he's in the hospital. He's in the ICU and traumatic brain injury unit. And it saved his life. And he woke up, and I was like, he just got a reset, but he's on Suboxone, and reading about that, it's like another issue, right? We need to help people who are addicted to this drug at every level, on a community level. We can't ostracize them. We can't say they aren't criminals. My son is not a criminal. He's not. It's just, it's portrayed as this thing that is on the other side of somebody else's fence, you know?
Right.
And I don't
Jennifer,
think there's anything being done.
Thank you so much for that call, and you know, best of luck as you help your son through this. I really appreciate you calling in. I want to go to both of our guests on this, but Dr. Volkow, you've gained notoriety for talking about the benefit of not treating this as not looking for punishment, but rather for treatment when you deal with people who are addicted.
Yeah, and I think that, what is clear is that criminalizing a person because they take drugs or because they are addicted, it basically not just continues to stigmatize them, but it also makes them much less likely to want to go and seek help. And this, in turn, is something that leads them to have lower self-esteem, to stigmatize themselves and make them so much more vulnerable to actually try to take drugs to escape. So it isolates them. And so absolutely, the science shows that when someone is addicted, that they don't control the urges, that they have the need. And I was listening to a caller earlier that said the differences between wanting and needing. And wanting drugs may emerge at the beginning when someone experiments, but once they become addicted, it's not that they want that drug, they need them. And their body perceives it as an instinctual need of food or water or even air in order to be able to breathe. So it's not a criminal behavior, it's the transformation that has happened in the brain of a person that now has this instinctual artificial need for drugs that are perceived as necessary for survival. And this is why it becomes such a powerful motivating drive for the person that's addicted. And that's why we conceptualize it in the process that the person needs to be treated in order to be able to control those strong urges to take the drugs and to also help them control the withdrawal that leads them otherwise to take drugs. And Suboxone, buprenorphine, is a medication that is very useful to help people achieve this goal, to stabilize them. And with time, this allows them to get back into their everyday life and eventually recover. So, because that's a message that I think is crucial that we keep on doing. Number one, addiction to opioids can be treated and you can recover.
Beth Macy?
Yeah, I mean, that was partly why it was so important for us with this Hulu show to show how hard it is for people to access treatments like Suboxone. You see an A-list actor like Michael Keaton struggle to get on methadone, stigmatized right and left, struggled then to get on Suboxone when that becomes available, and then eventually becoming a helper in his community. This is straight out of the pages of my nonfiction book, straight from the storyline of Dr. Steve Lloyd in rural Tennessee, who became a leader in providing addiction care. If we could change the thinking that Dr. Volkow talks about, and we could begin to treat addiction as a disease when, for instance, people are coming into the ED for emergency room for an overdose, and rather than just fix whatever they're in there for, Narcan or maybe correcting an abscess, actually connect them to peer support services, connect them to buprenorphine clinics. I mean, we have years of research showing that works. And similarly with jails, when people begin to get treated, and so that at the moment of release, which is so critical, such a time when they're much more likely to overdose and die, we see them get a warm handoff to a peer and to a next place to stay, connections to housing, connections to care. I mean, it makes all the difference in the world.
Let's go to another call that has come in. Raphael is joining us from Draper, Utah. Raphael, welcome to The Middle. Go ahead.
Hey, yeah, so from my experience, those drugs have not provided the escape that you guys are suggesting, because they are just as addictive, and the withdrawals are very rough when you come off of buprenorphine and Suboxone and all those other drugs as replacements. But my main question is, all the billions of dollars that are coming from like Johnson & Johnson, the Purdue family, the Sackler family, Walmart, CVS, like all them, like where is that money going? Like there are all these communities and lives that are just ruined, and like, are they saying any of that? Like where is it going? There's billions of dollars just floating out there.
Beth Macy.
Yeah, well, the problem is that every state has a different plan for how they're going to use the money. And we've already seen some early reporting from Kaiser Family Foundation showing that, some of that money is going to same old drug war, cops, cars, and more jailing, when we know that simply doesn't work. We need to make the treatments easier to access, whether that is in walk-in centers. Huntington, West Virginia, which had 26 overdoses in one day, now has walk-in centers where people can come in and get connected to care. I feel like every health department should be offering harm reduction services and connections to care.
Let's go to another call. Jeff is joining us from Boise, Idaho. Jeff, welcome to The Middle.
Hi, Jeremy. Thank you.
Thanks for calling. Go ahead.
Can you hear? Yeah. So, great topic. It's just, this is a God thing. I'm actually on my way to treatment as we speak.
Wow.
And I'm an alcoholic addict. And it is a disease. And I'm glad they finally acknowledged that. That made it easier for me an easier pill to swallow, so to speak. So, I actually overdosed on fentanyl 2 days ago. I tried it because it was available and I was going through withdrawals. I've been taking kratom, which is a legal plant that comes out of Indonesia, but it hits the opioid receptors and you don't go through withdrawals. And I've been on it for years, and I ran out and I started going through withdrawals. And I tried the fentanyl, and sure enough, within minutes, I was done. And luckily they had the Narcan there, I think it's called. And they gave me 2 doses of that. It took 2 doses. You guys nailed it earlier. If there was only 1 dose, I would be dead. And yeah, I died. So I got up and I'm like, okay, I'm done. I'm going to treatment. So I've been to treatment twice. First time was in Utah. It was a very, very nice place. I mean, top of the line, $30,000 a month. I was there for 3 months, and I didn't want to leave. It was amazing. But when I got out, what shocked me was the aftercare. There was none. They said, okay, write your exit plan, your aftercare plan, and this is what you're going to do. Well, it was all pie in the sky, and there was nothing there. They said, go to meetings, good luck. So I relapsed within 90 days. So I went back to another treatment center, same deal, no aftercare, and it's a problem. The aftercare is, in my opinion, one of the most important aspects. Yeah. So this time I'm doing something different. I'm going through a wilderness program. I'm going to be out of the wilderness for 50, 60 days. And there are some components and aspects of addiction to it. But I'm not going through the same old treatment traditional like I did before, because the aftercare is.
Yeah. Let me take that to our guests. Thank you, Jeff. I really appreciate it, and good luck. Good luck in the wilderness trying to get a handle on this. Dr. Volkow, what about that? That if you can find the treatment, that maybe it doesn't go on long enough to actually do what it's supposed to do.
Right. I mean, this caller has just his finger on the pulse of one of the main problems that we have in the treatment programs for substance use disorder in our country, that there's no continuity of care. Addiction is a chronic disease, and it requires treatment for a very long time period. And just like with hypertension and diabetes. So this notion that you go to a 3-month program and you're going to be able, once you leave there, to go back to a normal life without need and urges and craving is basically magical thinking. And the problem that we're observing is that many of these inpatient programs that actually are very, very nice, and while you are there, it seems to be working, don't have the referral system that will ensure that once you leave that intense service, that intense treatment, you will have someone that monitors your care as you proceed. And in fact, for example, what the studies have shown is that the best outcomes occur in those that have been sustained for treatment for 5 years. Initially, it's more intense, and as you go through time, the frequency and the intensity of the intervention goes down. And not very dissimilar to what you see with cancer, of course. I mean, at the beginning, you undergo treatment, and then they are checking you up every few weeks or months, and then they get paced off until there's a point that says, you've achieved recovery. The same situation happens with addiction, but we don't have the structure, nor we have the ways of overseeing that the treatments are providing the support that the person will need throughout this chronic state until they achieve recovery. So continuity of care is crucial for success, and this needs to be addressed in a more systematic way in the treatment programs we offer in our country.
We have heard from so many people with personal stories this hour about getting help, getting treatment. Beth Macy, I'm sure there are a lot of people who have family members, who have friends who are not at that point yet, who may be using, taking opioids in a way that they shouldn't be for their own health. And they have not admitted that it is something that they need to get treatment for at this point.
Right. The latest study, when I turned in Raising Lazarus in 2017, 1/3 of American families were experienced strife because of this issue. Just now, a recent survey, it's now 2/3 of American families are impacted by this, and yet, our treatment rates our overdose rates aren't getting any better. And it is so hard for family members to deal with. I mean, I have gotten close to so many families that have struggled with this, and there just isn't an easy answer other than continuing to connect folks to care. A woman I followed for Dopesick who ended up dying after 2.5 years of addiction. Her mother said, well, if she just hits rock bottom, then she'll snap out of it. And, she now says, rock bottom had a basement and the basement had a trapdoor. So we've all got to do our research so that we begin to shift the way we culturally think of this and start to think of it as a disease, not just a moral failing.
Just before we wrap up this hour, Tolliver, I know we've been getting some comments online. Maybe there's somebody with a question that we can get to.
Yeah, I absolutely love this question. Casey asks, does decriminalization of drugs in Portugal work? Is that a blueprint for us? Jeremy?
Dr. Volkow, is there any answer to that? Another person had written in about the same thing. What about decriminalizing things?
Yeah, and I think that it is a very interesting proposition. And I think that when we speak about decriminalizing drugs, we need to understand that there are different ways of decriminalizing it. And since you asked about Portugal, one of the things that Portugal did is not just the decriminalization of drugs, so you don't end up in jail if they find you with drugs. But what they did was they provide the treatment that the person needs. So they find drugs, so you go to treatment. And when we do other states are decriminalizing drugs, or other countries, they don't necessarily provide that treatment that is necessary to provide the support to a person. So just saying we're going to decriminalize and not provide support that will counterbalance the entry of drugs or the risk associated with them could actually result in negative consequences. On the other hand, if you decriminalize the drugs and you provide support and education, and one of the things that we haven't spoken at all during the program is the notion of prevention. How do we protect people? How do we build resilience so that people don't get addicted to it? And that is something else that has to be assigned with decriminalizing.
Well, you can reach out for more at listentothemiddle.com. You can also leave us a message at 844-464-3353. I want to thank my guest, Dr. Nora Volkow, director of the National Institute on Drug Abuse, and Beth Macy, author and executive producer of Dopesick, a book, now a TV series on Hulu, and her latest book, Raising Lazarus. Thanks to both of you for joining us.
Thank you for having us.
Thanks a lot.
And join us next week, same time, same place. Tolliver, what is our topic for next week's show?
Well, this might sound familiar to you, Jeremy, because it was supposed to be our topic last week, but got bumped. The topic is, are our political leaders too old?
Okay, and that means President Biden, former President Trump, Mitch McConnell, on and on. We're not picking on any one candidate. Again, we're at 844-4MIDDLE. You can leave a voicemail there or call in live next week or go to listentothemiddle.com. And while you're there, you can sign up for our weekly newsletter. The Middle is brought to you by Long Nook Media, produced by Joanne Jennings, John Barth, Harrison Patino, Danny Alexander, and Charlie Little. Our technical director is Jason Croft. Thanks this week to WUNC in Chapel Hill, North Carolina, to our partners at Illinois Public Media, Nashville Public Radio, iHeartMedia, and all the stations that are making it possible for people across the country to listen to The Middle. I'm Jeremy Hobson. Talk to you next week.
Over the last couple years, didn't we learn that the folding chair was invented by Black people because of what happened in Alabama?
The Montgomery Brawl.
This Black History Month, the podcast Selective Ignorance with Mandy B unpacks Black history and culture with comedy, clarity, and conversations that shake the status quo. The Crown Act in New York was signed in July of 2019, and that is a bill that was passed to prohibit discrimination based on hairstyles associated with race. To hear this and more, listen to Selective Ignorance with Mandy B from the Black Effect Podcast Network on the iHeartRadio app, Apple Podcasts, or wherever you get your podcasts.
1969. Malcolm and Martin are gone. America is in crisis. And at Morehouse College, the students make their move.
These students, including a young Samuel L. Jackson, locked up the members of the Board of Trustees, including Martin Luther King Sr. It's the true story of protest and rebellion in Black American history that you'll never forget. I'm Hans Charles.
I'm Menelik Lumumba.
Listen to The A Building on the iHeartRadio app, Apple Podcasts, or wherever you get your podcasts.
This is Ryder Strong, and I have a new podcast called The Red Weather. In 1995, my neighbor, Anna Trainer, disappeared from a commune.
It was nature and trees and praying and drugs.
So no, I am not your guru.
And back then, I lied to everybody.
They have had this case for 30 years.
I'm going back to my hometown to uncover the truth. Listen to The Red Weather on the iHeartRadio app, Apple Podcasts, or wherever you get your podcasts.
Saturday, May 2nd, country's biggest stars will be in Austin, Texas at our 2026 iHeart Country Festival presented by Capital One. Tickets are on sale now. Get yours before they sell out at Ticketmaster.com. That's Ticketmaster.com.
This is an iHeart podcast. Guaranteed Human.